Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Topic for our discussion is piles. This is also known as hemorrhoids. We'll look deeply into it. The important problem we face with this disease is there are other diseases that occur around anal region. Other diseases are fissures, fistula, skin tanks, and also there will be abscess around the anus. So normally what happens is people will mix up all these diseases and they take wrong treatment. Instead of taking treatment for the piles, they will mix up all these diseases and they will take the treatment. That is the important problem we face. Instead of, for example, if they are suffering with piles, they will wrongly diagnose it as fissures or fistula or anal abscess or tanks, and they start taking the treatment on their own. So if you have any problem around your anal region, it is best to consult a doctor, first diagnose it properly and then take the treatment. This is the important thing you have to remember in this regard. Anal canal will have arterial supply and venous drainage. So there are three arteries that will be supplying the entire anal canal. Those are superior rectal vein, middle rectal vein, and inferior rectal vein. There will be the radicals of this superior, inferior, and middle rectal vein. These radicals will get dilated in case of hemorrhoids. So the dilation of radicals of superior rectal vein, middle rectal vein, or inferior rectal vein, we call it as hemorrhoids. See, normally the veins should be in their position. When the walls of the veins get dilated and they protrude into anal canal, this we call as hemorrhoids. What are the important symptoms of hemorrhoids? First one is due to dilation of veins. Even though your stool is evacuated, you still feel that there is some stool left in your anal canal. And also there will be bleeding. The bleeding will be very specific. There will be 2 to 3 drops of blood when you defecate after you complete passing the motion. So you will get 2 to 3 drops of blood. And also there will be prolapse sometimes. Prolapse in the sense rectal veins will come out of the anal canal. It depends on the degree again. In first degree, you will not see any rectal veins outside. All the rectal veins are within the anal canal. In second degree, there is a prolapse of this dilated rectal veins. They come out of anus while passing the stool, and after you pass the stool they automatically go inside. In third degree, what happens is these dilated rectal veins come out of the anal region and they stay there. Unless you push them inside mechanically, they will not go inside. Once you push them, they will again go inside. In fourth degree, what happens is they will come out. Even you push it mechanically, they will not go inside. So these are the symptoms. And also there might be some pain. There will be mucus discharge, slimy watery discharge is going to come out of your anal canal. And also one more important symptom is anemia. So due to loss of blood continuously over a period of time, you can see even anemia in these patients. And coming to the investigations, proctoscopy is the investigation. Proctoscopy, there will be a small scope which will be inserted into your anal region. The inside of your anal canal is completely visualized, and even you can record it in the video form. This we call as anoscope or proctoscope. This is the important investigation we have to do for piles. This is to rule out other anal diseases, whether you have any fissures or you have any fistula or you have any anal abscess. This is the best way to get the perfect diagnosis. To understand this disease further, you have to understand about anatomy of the anal canal. The anal canal is the last part of the digestive system. It is about 3.8 centimeters in length and it is divided into three parts. First part is upper part, second part is middle part, and third part is lower part. Coming to the upper part is 15 millimeters in length, and in within this upper part there are vertical mucosal folds. We call them as anal columns. So within this anal columns, on the lower part of this vertical mucosal folds, they are connected with transverse fold. These are called walls of the anal canal. See, there is a slight depression between the two anal columns just above the transverse mucosal fold. It is called anal sinus. This upper part of the anal canal is drained by superior rectal veins. The radicals of the superior rectal vein will drain the upper part of the anal canal, and it is also insensitive to pain because it is supplied by autonomic nerves. Both we have sympathetic and parasympathetic nerves, so these are pain insensitive. Upper part of the anal canal is pain insensitive and it is drained by superior rectal veins. The radicals of the superior rectal veins are lined around the upper part of the anal canal. And coming to the middle part of the anal canal, it is about 15 millimeters in length and it is drained by middle rectal vein. This part is pain sensitive because it is supplied by somatic nerves. And coming to the lower part of the anal canal, this lower part is about 8 millimeters in length and it is drained by the plexus or the radicals of inferior rectal vein. This is also richly supplied by somatic nerves. That's the reason this is pain sensitive. And also at the base of the anal canal, these veins form a plexus that we call as external venous plexus, and the dilation of these plexus and the radicals of inferior rectal vein is the reason for external piles. And coming to the causes for the piles or hemorrhoids, the main reason is there is anatomical abnormality. We cannot say it is an anatomical abnormality. So basically what happens is the superior rectal veins valves in it. So if the veins has valves, the blood will be drained only in one direction. If they don't have the valves, the blood sometimes may come back. That is one of the important reasons. There will be some radicals of superior rectal veins are more prone to dilation. And coming to the risk factors and triggering factors, constipation. So if the person is having constipation and he is straining during constipation, so it put intra-abdominal pressure and the veins get dilated. And also other reason is diet. If you are taking fiber free diet, if you don't have fiber in your diet, this may again cause constipation. And also chronic diarrhea. If you are suffering with watery loose motions for a very long time, this can also lead to hemorrhoids. Not only diarrhea, dysentery. There are some diseases like amoebiasis where there will be dysentery, there will be mucus discharge from anal region. So that is also one of the causes for hemorrhoids. And coming to colic. Colic means pain. If you have constant pain in abdomen due to any of the pathologies, so you are more prone to get this dilation of the veins and hemorrhoids. Enteritis means if there are constant infection to your intestine, this may also lead to hemorrhoids. Sometimes cancer of rectum, we can see hemorrhoids in the cancer of rectum. And also one physiological condition is pregnancy. In pregnancy, due to increased abdominal pressure and these put strain on the veins, so the veins get dilated and you may land into hemorrhoids. And also difficult urination. If you have any urinary problems which is making you difficult to urinate and you are straining during urination, so this may lead to hemorrhoids as well. And also any tumors, for example, this is more common in females than males because they are more prone to tumors like ovarian tumors or fibroids. It will increase the pressure on the veins, which causes dilation of the veins in the anal canal. Coming to the pathology, what are the changes that will happen in the anal canal of a person who is suffering from piles? So we have to differentiate into internal piles and external piles. Internal piles occur in the upper part of the anal canal. This is the first part of the anal canal. There will be dilatation of radicals of superior rectal vein. Normally what happens is it is again divided into two parts: primary hemorrhoids and secondary hemorrhoids. So we have discussed that there will be vertical mucosal folds, right? We call them as anal columns. So within that anal columns, there are about 6 to 12 anal columns. In this anal columns, there are some bigger venous plexus. Within this anal canal, there are about 6 to 11 anal columns. Within this anal columns, there are 3 anal columns where the dilatation or the formation of hemorrhoids is more. That is the anal columns at 7 o'clock and anal columns at 3 o'clock, anal columns at 11 o'clock. At these places in the anal region, there will be dilatation of the veins. When the dilatation of the veins occurs at 3 o'clock or 7 o'clock or 11 o'clock, then we call it as primary hemorrhoids because these are large. So the blood drained or the dilation of these veins is heavy. That's the reason we call them as primary hemorrhoids. If the hemorrhoids or if the dilatation of veins other than the veins that are at 3 o'clock, 7 o'clock and 11 o'clock, any other anal columns are dilated, veins within those anal columns are dilated, we call it as secondary hemorrhoids. These secondary hemorrhoids are much smaller compared to the primary hemorrhoids. And coming to the degree, depending on the pathology and depending on the stage, we call it as degree. In first degree, the piles will not come out of the anal canal, they will be within the anal canal, you cannot see them outside. And in the second degree, what happens is these hemorrhoids or piles will come out only while defecation or while passing the motion. Once you complete passing the motion, they will go inside automatically. In third degree, what happens is hemorrhoids will come out while passing the stool, but they will not go inside on their own. Someone has to mechanically, you have to push them mechanically inside, then they will go inside of your anal canal. In fourth degree, what happens is they will come out of the anal canal. Even though you are pushing mechanically, they will not go inside of the anal canal. This is the fourth degree. These are all for internal piles. You have to remember there are no sensory nerves in the first part of the anal canal. So all these internal piles are painless. You will not have any pain when you have internal piles. Coming to the external hemorrhoids will occur on the lower part of the anal canal. which is only 8 millimeters in length. Here it is richly supplied by sensory nerves that are coming from somatic nervous system. These are formed by the dilatation of inferior rectal vein. Inferior rectal vein forms the plexus around the last part of the anal canal. This is highly sensitive to pain, and once these veins are dilated, you will see severe pain before passing the stool, after passing the stool, and also during passing the stool. So there can be sometimes thrombosis, means there will be clots of blood, there will be hematoma. Basically these are painful. You can also see bleeding when you have external hemorrhoids, and they can form hematoma, they can form clots within the lower part of the anal canal. Coming to the conventional treatment, conventional treatment is a treatment when you go to a doctor who is nearby your home, or to a specialist doctor. So we call this as a allopathic mode of treatment, or English form of medicine, or Western form of medicine. They have very limited scope in this case. They don't have any medicines to remove the tendency of hemorrhoids. They will just give painkillers, and they will give the medicines to relieve your constipation. Other than that, they don't have any medicines for actually to remove the tendency. So genetically they cannot remove the tendency, and this is also full of side effects. Even the laxatives which they give for smoothening the stool, it is full of side effects. That's the reason we don't suggest allopathic treatment in this case. Coming to the homeopathic treatment is best in this case, because you can not only cure the disease. When you have hemorrhoids, it will not only cure the hemorrhoids, but also it will ensure that it will not come again and again. So this is possible because of two treatments. One is local treatment, depending on the symptoms, what exactly happened in your anal region. Is it painful, is it not painful? So are you feeling pain before passing the stool, after passing the stool, or during the stool? Basically we take the local symptoms and give a particular medicine so that your disease is reversed. And also we will give constitutional treatment. Constitutional treatment is a treatment which we give by considering your genetic predisposition, and also your habits which you have got from the outside. By mixing up these two, and we give a medicine individualistic to you, then what happens is you will not get these piles or hemorrhoids again and again. So we can not only cure the hemorrhoids, we can prevent the hemorrhoids from further occurring with the help of homeopathy. All these are without any side effects. So you can treat with homeopathy medicine, and you will not have any side effects, even though if you take medicine for some time or for a long time. And coming to the affordability, homeopathic medicines are much affordable compared to any other system of medicine. So you can treat this with much fraction of cost compared to any other system of medicine. And also in allopathic system of medicine, there is surgery. You have to go with hemorrhoidectomy, you have to, this is a surgical procedure. And even though there are a lot of side effects for this surgical procedure. And coming to homeopathy, if it is in first degree or second degree, there is no need for you to go for surgery. If it is a third degree or fourth degree, we may try to cure it. But in the fourth degree or third degree, you went to allopathic doctor and you got surgically removed, and we can ensure that with our constitutional treatment you will not have this problem again and again. So homeopathy is very effective in first degree and second degree. In third degree we can try, but in fourth degree we also suggest you to go to surgery. After the surgery is done, if you come to us, we will ensure that you will not land into this hemorrhoids again and again, so that we can prevent your hemorrhoids in future. So in any of the degrees, homeopathy has very good scope in case of internal hemorrhoids. Coming to the external hemorrhoids are highly curable with homeopathy. There is no need for you to go to surgery. Whatever the complications that are occurring in external hemorrhoids, pain, thrombosis, or hematoma, or any other problem you are getting due to external hemorrhoids, can be completely handled by homeopathy alone. And coming to the precautions, what precautions you have to take to either prevent your hemorrhoids, or you have to take when you have hemorrhoids. First one is you have to take fiber rich food. You have to take both soluble fiber and insoluble fiber. You have to take plenty of water so that stool is soft. You have to have healthy toilet habits. You should not be straining during while passing the stool. And you have to exercise regularly. Take much liquid food like buttermilk, water. And also you have to take the vegetables. You have to take the vegetables as a whole rather than juices. You can take fruits. And also you can take flax seeds, chia seeds. And also avoid sedentary life. Have a good exercise balance in your life. Apart from this, you have to have good sleep regularly, and also lead a stress free life. so that you will be recovering well from the hemorrhoids. And coming to the prognosis, what happens if you don't take homeopathic treatment when you are suffering with hemorrhoids? First one is bleeding. There can be excess of bleeding for a long time, and you may land into anemia and other disorders. There will be thrombosis. The blood will clot in the anal region. The blood will clot and it causes some infections, and also strangulation. When in the third degree or fourth degree, if you don't take care of them, so there will be strangulation. The hemorrhoids will come out and they will not go inside again. There can be gangrene. Gangrene means death of the tissue, death of the hemorrhoids, or death of the veins there. And also sometimes what happens is there will be fibrous tissue formation, and this becomes permanent in the anal canal. And also there will be suppuration. Suppuration is highest form of infection. There will be heavy infection. So this infection may lead to inflammation of the veins within the anal canal. And also sometimes this infection can travel into liver, and you may have liver abscess, and that is a severe problem. So whenever you have hemorrhoids, whether it is first degree, second degree, third degree, or fourth degree, or it is external hemorrhoids, immediately if you can come to homeopathy doctor, we can handle it very well, so that you will not be landing into the complication. Thank you.